Namaste Vidya. Hamisha khush raho Vidya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in JAYOTI Vidyapeeth Women's University. In this series of infectious diseases, today we are going to discuss about Pyrexia of unknown origin, that is PUO. It is also known as fever of unknown origin. PUO, or the pyrexia of unknown origin, is defined as a temperature that is persistently above 38.0 degrees Celsius for more than 3 weeks. So, if a patient is having the temperature constantly over 38.0 degrees Celsius for more than 3 weeks without any diagnosis, despite of the initial investigations during 3 days of inpatient care, or after more than 2 outpatient visits. So if a patient is having temperature greater than 38.0 degrees Celsius for more than 3 weeks without any diagnosis and despite of the initial investigations during 3 days of inpatient care, or after more than 2 outpatient visits, it is any febrile illness without an initially obvious etiology. It is defined as fever greater than 38.3 degrees Celsius, that is 101 degree Fahrenheit, on at least 2 occasions. Second condition, illness duration of greater than 3 weeks. Third, there is no immunocompromised state when the patient is not having any kind of immunocompromised state. Fourth, the diagnosis that remains uncertain after a thorough history taking, physical examination, investigations like ESR, CRP level, platelet count, leukocyte count, and differential counts, hemoglobin percentage, electrolytes, creatinine, total protein, alkaline phosphatase, ALT, aspartate aminotransferase, LDH, that is lactate dehydrogenase, creatinine, kinase, ferritin, anti-nuclear antibodies, and RA factor, urine analysis, blood cultures, urine culture, chest X-ray, abdominal ultrasonography, and tuberculin test, that is TST. So even after all these investigations, even after all these tests, the diagnosis remains uncertain. You have performed adequate history taking, you have done physical examination, and you have carried out various investigations. Still, the diagnosis remains uncertain. Now, what is the etiology? The causes of pyrexia of unknown origin. The etiology includes various kinds of infections like enteric fever, tuberculosis, viral, fungal, etc. Different kind of infections. We have malignancies like leukemia, lymphoma, solid tumors in the liver, colon, stomach, renal, etc. There are various connective tissue disorders like SLE, systemic lupus erythematosus, Still's disease, and rheumatic fever. There are various miscellaneous conditions like inflammatory bowel disease, liver disease, Brugg reaction, thyrotoxicosis, etc. We also have few cases resolved spontaneously without the diagnosis. Now, what is the history that is to be encountered or inquired for the diagnosis of pyrexia of unknown origin? We have to ask for the travel history, whether the patient has traveled abroad and other countries of origin of various diseases like malaria, respiratory infections, viral hepatitis, etc. We also have to inquire about the personal and the social history, sexual history like HIV, hepatitis B and C, the occupational or recreational history that includes exposure to birds, animals, consumption of milk products, etc. Various investigations have to be performed like serological test for connective tissue disorders, autoantibody screening, complement levels, immunoglobulins, and cryoglobulins, echocardiography, ultrasound of abdomen, CT MRI of the thorax, abdomen, and or brain. Various other investigations includes imaging of the skeletal system, plain X-rays, CT MRI spine, isotope bone scan, labeled white cell scan, positron emission tomography, that is PET scan, single photon emission, computerized tomography, that is SPECT, single photon computerized tomography, that is SPECT, and biopsy. Now, what is the prognosis and management of pyrexia of unknown origin? The mortality of PUO is 30 to 40%, mainly attributable to the malignancies in older patients. If no cause is found, the long-term mortality is low and fever often settles spontaneously. The treatment consists of finding the cause with a general management that includes paracetamol, tepid sponging to cool the skin, and replacement of the salt and water, antibiotics and antitubercular therapy, colchicine, non-steroid anti-inflammatory drugs, and glucocorticoids. So this was all about pyrexia of unknown origin. In the next lecture, we will be discussing about various viral infections. This session was powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. This was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.